having cancer does have some perks, you know. Before I got sick, no one was going to put me up in a nice big hotel room and feed me snacks and listen to what I wanted to say. But now everyone pays attention to me, so, you know, there's always a bright side. Hi, my name is Peter Mazaru. I'm 20 years old, and I've just finished treatment for acute lymphocytic leukemia. I was diagnosed at age 18, just after I finished high school. In the summer of 2006, I was 18 years old and had just graduated from high school. My friends and I had planned this big trip where we were going to go canoeing out in the wilderness as far from civilization as we could get. And just as the trip was coming up, after we'd been planning it for all this time, I started to get sick. I had a fever and didn't really know what it was, but it wasn't going away. I wanted to go anyway, but my mother convinced me to go into a clinic to get checked out first, just to be safe. 3 blood tests and 2 doctors later, I was sent to the emergency room, and after a week in the hospital, I was diagnosed with acute lymphocytic leukemia.
We're presently conducting a test for the fire alarm system. Please disregard any alarm tone. This is only a test.
I moved down after my diagnosis to downtown Toronto to begin treatment at Princess Margaret Hospital. I spent a month getting intense inpatient chemotherapy and eventually achieved remission. But that was only the first step. After that, I immediately had to start 2 weeks of daily radiation to the brain and a series of lumbar punctures, which, if you're not familiar with that, are needles in your spine, which are never a lot of fun. And then after that, I had 6 months of intense outpatient chemotherapy, which meant that I got to go home, but every week I had to come back down and get another dose of chemo. After I finished that, I had a 1.5 years of maintenance chemotherapy, which is a little bit easier, and I finished that just 12 days ago. Like any cancer patient, I had my fair share of complications. The chemotherapy that they were giving me caused me to have a seizure and multiple painful episodes of pancreatitis. And just like any other cancer patient, I was prone to get infections all the time and ended up in the emergency room more times than I'd like to remember. Overall, I was treated in 5 different hospitals in the area for one reason or another. I had my fair share of low points where it seemed like I was just getting bad news every day. I'd have tubes sticking out of me everywhere, and I was eating through an IV bag, essentially, for a little while. But eventually, things evened out and got a little bit better, and now, today, every day, I feel like I'm getting back to normal more and more. It's difficult to try and maintain any kind of a normal life. You know, my friends were really good about it and never really treated me differently, but it was really hard for them to kind of relate to what I was experiencing because they were essentially living totally different lives than me. There's a real sense of isolation when you're the only person you know your age who's going through chemotherapy and that kind of experience, and you can't move on with your life. You know, all of my friends and colleagues and peers were going off to university and starting their lives, and I was just sitting at home, not really anything to do. So I've often thought it was kind of like there was an invisible wall between my friends and I where we could talk, but they couldn't really understand or relate to me. So I think that's one of the biggest reasons that this disease has such an impact on people's lives. And the hotel's on fire, I guess.
This is the test.
Independence is definitely another big issue that you have to deal with. And that's really specific, I think, to the young adult age group, because you're just at the age where you're trying to become independent from your parents, move out of the house, go to school, and start your own life. And for the majority of young adult cancer patients, that doesn't happen. And oftentimes you have to move back in with your parents, or in my case, never move out. And you become dependent on them financially because you can't work most of the time, and because you're sick, and you just don't have the energy to really take care of yourself all of the time. So it can be really hard to kind of deal with being almost treated like a kid again and not being able to be where you feel you should be. The Chasing Rainbows video was one of the first times that I'd seen young adult cancer survivors or patients talking to each other about the issues that really affected them. And that's what kind of started me down the road to getting in touch with some other cancer survivors my age personally, and hearing their stories and talking to them, and that really was a big help to me. And I think it would be to almost anyone. As far as some of the resources available for young adult cancer patients, there are some out there, but they're hard to hear about. It's not like when you go into the hospital, someone will always just kind of hand you a list of everything you need to know. For me personally, I always kind of figured, well, you know, support groups, I don't need that BS. That's just kind of hippie stuff, and I don't really need to deal with that. I'll just get through it. And it's really not like that. And the reason I got in contact with some other cancer patients near my age was when I actually started seeing a counselor, and she just gave me a pamphlet for a website called Young Adult Cancer Canada, who connects young adult cancer patients from all across the country at retreats and get-togethers, and just through the web as well, just to exchange information so that you can talk to someone else who really gets it and really understands. And that makes a big difference, you know, because really there's no one else you can talk to that same way. And it's difficult to do in a really informal setting like using email. You can't really get across what you mean in the same way as when you actually meet someone face to face. So I think it's really important to be able to meet other people, or at least hear them talk openly and honestly about how they're feeling. And when you hear that, I think it'll really help you to realize that you're not alone going through this. My plans were kind of vague, but I knew that I was going to go back for one more semester of high school, then go to university. And I didn't know what for, but I thought I'd just kind of figure that out when I got there. When I got sick, I had to put everything on hold, drop everything, and basically just stop living the same life for about 2 years. And that was a real letdown, but it also gave me time to think about what it was that I wanted to do with my life, because up until then, I had no idea. And now that I'm finished, I've had the time to decide that I want to go into journalism, and I really want to kind of make the most of the time that I have. So I'm also planning on a trip this spring to go backpacking through Europe. I'd like a large chocolate cake, medium well done steak, and a bottle of tequila, please. Just send it up and charge us through. Another one of the great perks.